Hi there. I know that you're thinking that sugar is the cause of diabetes, right? Like I said the last edition, sugar is not the cause, right? The same way rainfall is not the cause of flood, right? The cause of flood is that there are no drainage system, okay? So sugar is not the cause of diabetes. The cause of diabetes is that insulin is not being used by the body, either because it's not available or the body is not sensitive to it. Okay, so I want to discuss the causes of diabetes. Okay, now the causes of diabetes depends on the type of diabetes that one is suffering. Okay, for type 1 diabetes, now what happens is that the insulin is not produced by the pancreas. The islet cells in the pancreas is supposed to produce insulin that helps in the metabolism of carbohydrate. Now, when this insulin is absent, it leads to the sugar accumulating in the body. So type 1 diabetes, the cause is genetic. It is unknown. Nobody knows that. It's just the cause is that immune cells attack these islet cells in the pancreas. They see them as an antibody and fights and destroys them. Now, leading to the insulin not being produced. All right. So this is the cause of type 1 diabetes, and it's majorly genetic. It is family. Okay, it could be in family history, disease history of some people. Okay. Now, for type 2 diabetes, the cause is that the body has insulin produced. Okay, insulin is available, but the body is not making use of it. That is, the body is resistant to it for one reason or the other. There are several reasons which I will mention when I'm talking about the risk factors. Okay, one of the reasons is that one is not living a physical active life. Okay, you're obese and you're not active. Okay, you have a lot of weight and you're not active. This can lead to insulin being resistant to the body for its metabolism. Okay, now the final one, which is the gestational diabetes, the cause is that when the woman is pregnant, okay, the placenta, there is a lot of hormonal changes that happens, and the placenta produces hormones which is needed for the fetus to grow and develop effectively. Now, when these hormones are produced by the placenta, it inhibits the way the body, metabolizes, sugar. It affects the secretion of insulin or the resistance of insulin. The body making use of insulin is in jeopardy. Okay, so it can be that the body is not producing insulin, or that the body is not making use of insulin. All right, so it could be either of the two. All right, or even the two of them. All right, so these are the causes of diabetes. All right, so the next point is that you need to know the symptoms of diabetes. Okay, a lot of us don't understand that the symptoms of diabetes, when you know them, you are better prepared to know when to go see your doctor. I'm not telling you this so that you know when to start taking treatment for yourself. I'm telling you to know when to go see your doctor, who is the person certified to medically diagnose you and tell you if you're diabetic or not. Okay, so There are 3 P's that are very essential for diagnosis of diabetes. When you see these 3 things, or most of them, you discover that you need to go see your doctor immediately. We call them the 3 P's of diabetes diagnosis. Okay, they are polyuria, polydipsia, and polyphagia. Polyuria is the frequent urination, okay? Polydipsia is the frequent drinking of water. And then polyphagia is the frequent eating of food. Now, you discover that your cell, like I said, is being starved, okay? So most of your cells, they don't find food to eat, okay? And that is why you have all of these things happening, okay? Your cell is requiring food, and that is why you're eating. You're thinking that there's no sugar in your body. You eat, and then the cells in the kidney or what have you, they are lacking water. They feel that there's not enough water in the system, but however, there is water in the system, and you're releasing a lot of water, in your urine. Okay, you're releasing a lot of water and you're taking in a lot of water. So it's like a cycle. It's a systemic condition, like I said, a systemic breakdown, that over a period of time you discover that there's a cycle that is happening if you're not able to control your sugar. Okay, so this is the 3 P's of symptoms of diabetes. You use it, to know if the person needs to go see a doctor who will now certify that you're diabetic or not. All right. So there are other symptoms. Now, another thing is that you discover a blurry vision. Okay, some of you may discover blurry vision. You discover fatigue. You're extremely tired. Almost every time you're extremely tired. You have slow wound healing. Okay, and then for men, you have erectile dysfunction, and then you lose interest in sex because of it. Okay, because you don't want to go there and then mess yourself up, and then you're not able to satisfy your wife and all of that. So you gradually lose interest in sex. Poor muscle strength. Poor muscle strength is another symptom for men. You don't have enough muscle, to do things. Okay, you're not able to do the things you do normally. Okay, you're always weak. Like I said, it's a systemic problem. The cells in the muscle cells, they are weak, they are hungry. So you're not able to make use of the cells of the muscles, to carry out your normal activities. For women, one of the things that happens is that you discover vaginal dryness. Your vagina will begin to dry. Okay, you're not able to have that natural lubricant that comes with, being in the mood for sex. Okay, so it dries up because there's a presence of sugar in the blood. The sugar is supposed, to be used by the cells for different functions, and so when it clogs in the blood, it inhibits other things from taking place. Urinary tract infection, it can happen to women, okay, during this period. You can have UTI. Yeast infection can also happen. Yeast infection, and then there is always this itchy skin, dry, itchy skin that happens in women that have diabetes. You discover it, your skin will start to get so dried and shrinking. It's still the same thing. The cells are being starved. Okay, they get so itchy, and you see your skin, and they are all dried up. It's as a result of this same diabetes. Okay, when you're hyperglycemic, okay, you discover some of these symptoms in you as a woman. All right, so this is it for symptoms. Now let's get to the risk factors. For each type of diabetes, there is a risk factor. Okay, and I need you to understand this. Type 1 diabetes, there's only one risk factor, and that is genetic. It runs in the family bloodline. Okay, that's the only thing that causes, the only risk that you have for everybody, both male and female. It's a genetic risk factor. So you will only be praying that you don't run into the families that have, such gene in their system. Okay, so for type 2 diabetes, there are a couple of risk factors. One of them is weight. Overweight or obese, you're more predisposed to having type 2 diabetes. And then once you get to the age of 45 and older, okay, this is if you don't have it earlier, right? There are exceptions, like I said earlier when I was talking about the types and the subtypes. I told you that there is a type of type 2 diabetes that comes earlier. Okay, there's a type of type 2 diabetes that comes earlier in childhood or earlier in younger persons. Okay, so when you don't have such, the only risk factor you have is when you get to age 45 and above, you have the risk of having type 2 diabetes as well. Sedentary lifestyle. You're not active as a young person, you're not active as an adult, you don't have time to exercise your body, you're always relaxed, you're always sleeping around, you're always lying down, you're not active, like you don't exercise. It's a major risk factor for many people who had diabetes, especially bankers. I usually tell them, especially bankers, you sit a lot in one place and you work all day and then wake up and go home. So there are people that sit a lot of times or lie down a lot of times. They are more predisposed to gaining weight and having diabetes. Okay. Another risk factor is for people who have had, gestational diabetes in the past. Okay, probably you've had gestational diabetes in the past, or you suffered from gestational diabetes during your childbirth. You're predisposed to having type 2 diabetes later in life, especially when you had a microsomic baby. That is a baby that had 4 kg and above weight at birth. Okay, 4 kilogram weight at birth. Anything above 4 kg, from 4 kg and above at childbirth, okay, you're predisposed to having diabetes, especially if you had gestational diabetes during that period. And then for people who have high blood pressure, high cholesterol, triglyceride, and all of that, you are also predisposed to having these, condition, diabetes. Now, for women or gestational diabetes, there are people who have genetic problem. Women, okay, the risk factor you have is genetic. It could be that your mother, had the same problem giving birth to your siblings and you, okay, and polycystic ovarian issues, okay. People that have that condition are predisposed to having gestational diabetes. Okay, so it could happen to anybody. Okay, so you need to watch out. You need to watch out for it and watch your diet. Your diet is also very important. Okay, I will discuss polycystic ovarian syndrome, okay, in another video, completely different from this. Okay, that will be later. Diagnosis. Okay, the diagnosis is one place that a lot of people wants to know. How do I know that I have, diabetes? How do I know? How do The truth is that, like I said, it is only your doctor that is certified to tell you if you're diabetic or not. And that is why when you see these symptoms that I mentioned earlier, any of them or most of them, you should go to your doctor who will run these tests. Okay? Now, there are two major tests that the doctor uses to, diagnose if you're diabetic or not. There are two major tests. One is your fasting blood sugar level. Okay, it's used to check the amount of sugar in the blood within 24 hours. Okay, there is another test that they use to know if you're diabetic. Okay, now this test is called glycated hemoglobin test. Some of you know it as HB1AC. That is what it is called. All right. For fasting blood sugar, okay, there is a mark, okay, that is used. Okay, there is a particular normal reading that we use as a standard to know when somebody is diabetic or not. Now, between 70 and 110 is adjudged to be normal. Okay, between 70 milligram per dl and 110 milligram per dl, it is adjudged to be normal. And anything above 110, from maybe 111 to 125 milligram per dl, it is adjudged that the person may have pre-diabetics. Okay, now anything from 126 and above, now the person is adjudged to be diabetic. Now, but it is not that somebody has 126, maybe one off, or maybe after the person has eaten and then you think that it has to be a consistent stuff. Okay, the person must have had it consistently. The result has to be consistently taken, for you to arrive at this 126 milligram per dl in that fasting blood sugar, and then the doctor can now say that the person is diabetic. Okay, now for glycated hemoglobin, there are standards. Okay, and one of the standards, the normal, is that anything below 6.4%. Okay, anything below 6.4% is assumed that the person has normal. Okay, it's normal, and this thing checks the blood sugar level in that person for the period of 60 to 90 days. It is more accurate if you want to use it to check, if somebody is diabetic, if the person is even predisposed to being diabetic in the future. This can give you an idea of that. Okay, for the future, it can also prevent, help you prevent, that occurrence. All right. So these are the two basic ways that diabetes is diagnosed. Of course, there are other, tests that you can use to distinguish, the type of diabetes, whether it's type 1 or type 2. There are other tests, which they don't usually use in this kind, but they exist. Okay, they exist. They use it to, the intricacies around diabetes. The test is used to check them out. Okay, now this is where we will draw the curtain on this episode of Dietitian Review. I hope you've gotten value from this. Now, this series is still on because we are still going to talk about the complications, we're still going to talk about the treatment, we're still going to talk about the dietary management. I'd like you to subscribe to this channel and click on that notification so that you'll be able to know when we release our videos, our subsequent videos on this. Okay, I know you've gotten value. I'd like you to click that like button, share, and let other people benefit from this video, because the reason why we are doing it is for people to get the knowledge. The knowledge is the key. All right, so please help us share, like, and then subscribe and click the notification bell. I remain your dietitian Fechi, and I'll see you in the next episode. Bye for now.